There is a battle unfolding in American healthcare, and most people watching it don't even realize who is actually standing in the middle of the battlefield. It's not politicians, it's not healthcare executives, it's clinicians. This week, a major legal conflict erupted in New York when the state's attorney general demanded that NYU Langone resume gender-affirming treatment for transgender youth after the hospital paused services. The hospital cited regulatory uncertainty and leadership changes. The state warned that stopping treatment could violate anti-discrimination law. On the surface, this looks like a political fight between government and institutions. But inside the hospital walls, this isn't political theory. This is clinical reality. Doctors, nurses, therapists, and healthcare professionals are the ones now standing between three powerful forces that are pulling healthcare in different directions at the same time. State governments demanding access to care, federal political pressure threatening hospital funding, and the ethical responsibility of clinicians to make medical decisions based on science, training, and patient welfare. This is the collision point. And the question healthcare professionals are quietly asking behind closed doors is not about politics. It's about control. Are politicians deciding clinical care? Are hospitals making medical decisions based on financial survival rather than medical judgment? And are clinicians now expected to carry the legal risk for decisions that may not even control? Because here's the truth that very few people outside of healthcare understand. When policy battles erupt at the top, the responsibility falls to the bottom, the clinician. The nurse who must carry out the order, the physician whose license is on the line, the therapist expected to navigate care in a system shaped by legal pressure. And when healthcare becomes a political battlefield, clinicians become the ones exposed, not just professionally, legally, psychologically, and ethically. Regardless of personal beliefs about any specific treatment, the core issue every healthcare professional should be asking right now is this: who ultimately owns medical decision making? Because if clinical care begins shifting based on political cycles, funding threats, or legal pressure instead of evidence-based medicine, then healthcare professionals are no longer practicing medicine. They are navigating power structures. And that changes everything about the future of healthcare. This moment is bigger than one policy. It's bigger than one hospital, and it's bigger than one state. This moment forces healthcare to confront a critical question. Will clinicians remain the decision makers in medicine? Or will they become the liability holders for decisions made above them? Healthcare professionals across this country are watching closely because when clinical autonomy erodes, patient care changes. And when clinicians are forced into political crossfire, the entire healthcare system feels the impact. Healthcare does not need louder political arguments. It needs something far more powerful: clarity, protection, and the courage to defend the integrity of clinical judgment. Because at the end of the day, medicine must be guided by evidence, ethics, and patient welfare, not politics.